Hello, my name is Dr. Drew Moffitt, and I thought I'd make a video to try and explain a little bit about some of the confusion that might be out there about wearing masks. You probably have heard the government say that we should not wear masks, and yet at the same time they're saying how there's a desperate shortage of masks and masks are needed for healthcare workers. So, what is the mismessage there? Well, it has to do with the fact that there are basically two types of masks. There are masks that are surgical type masks, and there are masks that are respirator type masks. So what's a surgical mask in the first place? Well, a surgical mask is a mask that a surgeon wears during surgery. The purpose of that mask is to help prevent the surgeon from infecting the surgical wound that he's operating on. So essentially it's helping protect the patient from the doctor. It doesn't really protect the doctor from the patient per se. The other type of mask is a respirator mask. Respirator types of masks, and there are many different types of masks, do prevent the wearer of the mask, or at least reduce their risk of being infected from other people. So again, I'm just going to talk about surgical type masks and respirator type masks. So why is the government recommending us not to wear masks? Well, the first concept is that most people, if they were to get a mask, it's going to be a surgical type mask, meaning it's not going to protect them from being infected by other people. It will reduce their ability to transmit the virus to others, but it's not going to protect them from being infected by other people. They also talk about how if you're wearing a mask, there's a greater risk that you might self-inoculate and actually increase your chance of becoming infected. The idea there is if you're wearing a mask, you'll touch the mask and then you'll touch your eyes or some other part of your face. Well, I don't really buy into that. I tend to touch my face a lot, and when I wear a mask, I'm more cognizant of the fact that I have a mask on my face and that I shouldn't touch that mask and I shouldn't touch my face. So I don't think it's really necessarily correct that people wearing a mask are more likely to infect themselves. The main reason why the government is trying to discourage us from wearing masks is the fact that there simply are not enough masks available for the general public to purchase a medical grade mask, especially respirators. Respirators are in particularly short supply, and those are the masks that do protect healthcare workers from being infected, and they're desperately needed. The other issue is that the government is concerned that if we wear masks, we will be less likely to self-quarantine. So we'll think that, hey, I got a mask, I'm just going to go out there, it's okay. And because of that, perhaps increase our exposure, where actually the safest thing, which I agree with, is to stay at home. So the instructions we're being given in most settings is that we should stay at home and only go to the grocery store about once a week or the pharmacy when we need to. And that's good advice. However, Saturday I was at the grocery store and it was impossible to maintain that 6 foot of social distancing at the grocery store, especially when you're waiting in the line for toilet paper or trying to check out at the grocery counter. You simply cannot maintain a 6 foot social distancing in a grocery store. So, what does the government currently recommend about masking? Well, basically what they say is that healthy people don't need to wear a mask and 6 people should wear a mask. Well, why did they say 6 people should wear a mask? Well, that's because to reduce the ability of the sick person to transmit the virus to another person. They completely support that that should be done if possible to reduce transmission, agreeing with the concept that wearing a mask does something. It reduces your ability to transmit the virus to another person. Well, what about the concept of healthy people don't need to wear a mask? Well, the problem is that in the context of transmission of the coronavirus, there is no such thing as a healthy person. What I mean is that people who think they are healthy, they don't have any symptoms, can be infected and can transmit the virus to other people. That's the whole reason why this pandemic is exploding, is healthy transmission or asymptomatic transmission from people who feel they are healthy, but actually are infected with the virus. So, what's the solution? What do we do? Well, a solution is what's called universal masking. Universal masking is the idea where everybody in a certain space wears a mask. Now, in that context, no single person is being protected from transmission from other people, but they are limiting their ability to transmit the virus to others. If everybody in that space is wearing a surgical type mask, then total transmission of the virus is reduced in that space. So why is this not being recommended by the government? Well, it's simply that there's no way to immediately help everybody have access to a surgical type mask. There simply are not available for everybody to go out and buy a medical grade surgical mask. But what if you could make a mask in about 10 minutes from stuff you just have laying around the house? Well, way back in 2013, after the H1N1 pandemic, researchers investigated, what stuff do we have around the house that might be able to reduce transmission of the virus? And they looked at lots of different things and basically concluded that the common 100% cotton t-shirt is the best thing that could reduce transmission of viral particles the size of the coronavirus. So in their tests, what they found that a medical grade surgical mask reduced transmission of particles the size of the coronavirus about 89%. So it blocked 89% of viral transmission. But a common t-shirt blocked 70%. So again, not as great as a medical grade mask, but a medical grade mask isn't 100% either. So again, it's not perfect, but it's better than nothing. And what we need right now is a better than nothing solution. So what I'd like to do is show you how you can make a surgical type mask in about 10 minutes using just a pen, scissors, and an old t-shirt in the back of your closet. All right, here we go. So here is an old t-shirt that I had in the back of my closet. And the first thing you do is you look at the tag. The tag here, it says 100% cotton. Okay, so you got a 100% cotton t-shirt. So the concepts here are the t-shirt has some fundamental things that are going to help guide you, and you're going to be able to do this completely without using any type of measurements. If you're using a t-shirt that you wear, in the end it will end up fitting you well because there are aspects about the size of the shirt that make it work well for sizing. So the first thing you want to do is you want to end up making your first cut along this seam here. This is a stitch seam, and it will provide the beginning of the ties you use to tie the mask. So it's important to make your cut on the size where this tag is. So this part of the mask is going to end up being the mask, or this part of the t-shirt is going to end up being the mask. And so you find the tag, this is the side, and you find that seam. You want to make, you can see that it kind of goes like this and goes on an angle. You're going to make your cut right here, so you're going to extend a cut this way. So we're going to start doing that. You have to be bold and just make that first cut. You want to avoid actually cutting this stitching part. So make sure your cut is on the cloth part and not on the stitching part. And you just basically follow your cut along this line. Very simple. Make sure you're not cutting the actual underlying cloth. like that. So don't do what I do. I actually did make a cut here, but that won't matter because we're going to end up getting rid of this part of it anyway. Then this is going to be one of the ties. Now usually this is long enough, but to be on the safe side, we're going to include this part of the sleeve. So you want to go ahead and kind of find something like that, and that's where you're going to continue your cut. So find where you were and just continue your cut along that crease. Like that. Okay? So that gives you your first cut that way. And then you're going to go ahead and do that same thing on this side. Okay? Again, you're going to take your cut. You're going to cut like that, staying on the outside. And you're just going to go ahead and cut all the way along the outside of that seam, not cutting the seam itself. Like that. Okay? Then you're going to pick up here, and we're going to continue this because this is going to help us to make the tie longer, and you'll see what I mean by that. So you just come along here. All right, so now you made the first cut of your cloth. Okay? Now you want to go ahead and extend this back this way. But first we're going to measure the mask dimensions, okay? Okay, so now you've got your cut t-shirt, and now you want to figure out how big is the distance from here to here. I think the easiest thing is to just place the collared part right under your chin, and then lift this up to the bridge of your nose, like that, and then pinch it off. And I've got that held right here. And then I'm just going to make a cut right there, and that's going to give me the height or the distance of the mask itself. Okay? Helps to have. So I made a little cut there, so now I know where that reference point is. Okay? The next thing I'm going to do is I want to figure out how thick the mask is. So the distance between the collar and this way. So that distance is essentially the back of your jaw to the top of your ear. So you basically take that measurement. So what I do is I lay down the mask like this, and then I take this measurement and I keep that distance and I put it down on the mask, which I'll show you. Alrighty, so now I have the mask, or now I have the cloth set out, and I need to figure out what distance I'm going to have the mask be. So again, I take that measurement from my jaw to the top of my ear, and I set it down here, and I make a little mark with a Sharpie. And then I do the same thing over here, just so I am making sure I'm being accurate. And I take that and do it like that and put a mark there on my Sharpie. Okay? This is going to be the width of the mask. This is the height of the mask right here. That's that cut I made. Okay? Then the next thing I want to do is the top ties. So if you just take the width of your thumb, right, or from your knuckle to your thumb, and you set that there, that's going to be a good thickness for the top of that tie. So you just set that on there, and the thickness for the top of the tie. Okay? Now you have all your measurements. If you are a kind of a accuracy freak like I am, you can draw a little pattern of how you're going to make that cut. All right? Then you go ahead and draw a line from here to over here, okay? And again, this isn't rocket science. You want the other side to be this. This is going to be the top tie. So the thickness from here to here and here to here. So you can just kind of free draw that like that. Again, this isn't rocket science. That's a cut I made that I shouldn't have made, so avoid that at all costs. You just kind of keep that same thickness, more or less, like that. And then over here, you're going to take this line and you're going to go to this corner right here. Again, you want to put your other thumb distance like that, and then you're just going to draw a line to here and a line over to here, like that. Now you've got the pattern, you just need to cut it out. This is going to be going to right here, this is going to be right here. And so the next thing you want to do is you want to cut, this is going to be one tie and this is going to be the other tie. So you can just kind of extend this like this. On this tie, remember, don't cut the seam. Let me get this, make sure it's in the field so you can see it. All right, now you have your mask, okay? Okay, so how does this mask work? Essentially, you're going to put the top part that has the collar over the top and take this around the back of your head, okay, right around the base of your neck, and you tie that. Then this, you have this loose part, you're going to take these longer ones, take it around, and I find it's hard to tie behind your back, so if you just tie this in front, now you have a mask. It has very good seals on the side, very good seals here, very good seal underneath, and very good seal on the side. And now you have a homemade surgical type mask that can reduce the transmission of the virus. So now you got your mask. What are you going to do with your mask? Well, you put your mask on when you go out of the house to go to the grocery store or the pharmacy. You're not going to be wearing this thing all day. You're going to just wear it there and back. It can easily be and should be washed after each use. The CDC guidelines say you can use simple detergent that you normally use to wash clothes. If you want to be extra careful, they advise using a bleach solution of 1/3 cup bleach per gallon of water, and that is a sufficient concentration of bleach to eliminate the risk of the coronavirus. So, what is the main problem with this idea? Well, the main problem with this idea is that the word universal. It really only works if it is universally adopted. The chances of that happening immediately are less than 0. So how could we improve the probability that this would be adopted? Well, the first concept is to decide in your own heart why you're wearing a mask. You know you're not wearing this mask to protect yourself. But by wearing the mask, you're protecting your neighbor. And by protecting your neighbor, at least you are not contributing to the problem. And so what I recommend is taking this mask and writing on it the following. So what I recommend is taking your little mask here, and on the side that's white, that's the inside of the mask, writing the following. Writing for you. Okay, well there's my little video on how to use universal masking to help reduce the risk of transmission of virus to other people and hence help protect all of us. Now, I know what some of you are saying. That's a stupid idea. Not everybody's going to do it. And you're right. It is a stupid idea. And not everybody is going to do it. But what you can do is 10 minutes from now, you can have a mask that will protect you from infecting your neighbor. And so why not do that? And so you start wearing your mask, and next time you go to the grocery store, maybe 20% of people are wearing a mask. And then the next time you go to the grocery store, maybe 50% are wearing a mask. And the next time you go to the grocery store, maybe 80% of people are wearing a mask. And in the end, those people who aren't wearing a mask feel that they should, and the next time will. The reality is we can only do what we can do. But this is something that we all can do. And if we do, it might help somebody not get the virus. We all try to bring a reusable grocery bag to the store to help save the planet. We can all wear a reusable mask to help save the world. Thank you for watching, and be safe out there. Bye-bye.